Hello. Thank you for taking a few minutes with me to learn about the University of Colorado's Obesity Medicine Fellowship. My name's Dan Bessesen, and I'm professor of medicine in the Division of Endocrinology, and I'm the director of the program. I think you've chosen an exciting time to seek training in obesity medicine. I'm an older person, and people from my generation, we kind of taught ourselves how to do obesity medicine. That's probably not ideal. You're going to be the first of a generation of people who have formal clinical training in obesity medicine. And as a result, you're going to be a leader in your hospital, in your institution, and in our community in obesity medicine. And this is happening at a time when the treatments are becoming more and more effective, and people are recognizing obesity as the chronic health problem that it is. We want to help you become the best obesity medicine practitioner that you can be here in our fellowship program. To accomplish that goal, our fellows primarily spend time seeing people with obesity in our weight management clinic here at the Anschutz Health and Wellness Center, where I am today. That's a multidisciplinary clinic staffed by 6 obesity medicine physicians and 3 advanced practice providers. It's also staffed by nutritionists and an on-site psychologist. Our fellows also spend some time at the Colorado Children's Hospital, which has 2 lifestyle clinics, one for young people who simply have obesity, and another clinic for young people with complications such as type 2 diabetes, sleep apnea, orthopedic problems, or adolescents that are seeking bariatric surgery. Our fellows can elect to spend some time at the VA hospital or at our city and county hospital, Denver Health, both of which have lifestyle and weight management clinics. Our fellows spend time with 2 practitioners in the community. These are good docs. One of them is a past president of the Obesity Medicine Association. The other has done important advocacy work, working to improve coverage for anti-obesity medications. This allows our fellows to see obesity medicine not just at an academic center, but in private practice. These core obesity medicine clinical experiences are supplemented by rotations in relevant other subspecialties. These include spending time with the bariatric surgeons, spending time with a gastrointestinal endoscopist who provides weight management treatment endoscopically. Our fellows spend time with the sleep medicine specialists, with fatty liver clinic, with hyperlipidemia clinic, and other related subspecialty clinics depending on their interests. We have a robust didactic curriculum for our fellows where our faculty make sure that our fellows are up to date on the latest literature and new scientific and clinical developments in obesity medicine. There's the opportunity for scholarly work, either a quality improvement project or a formal research project. Here at the University of Colorado, we have a NIH-funded Nutrition Obesity Research Center with more than 100 investigators doing work in nutrition and obesity. We also have a clinical trials group where we're doing studies on the next generation of anti-obesity medications that are even more effective than what we have now. These include retatrutide, semaglutide, and cagrilintide, and others. We also have an NIH-funded T32 grant for those individuals who'd like to stay on for a couple of years more of focused research training. I think there are 2 things that I think separate our program or are different in our program than other programs around the country. One is the way we're funded. At some programs, fellows bill for their services, and that provides revenue to cover their salaries. Here, our fellowship is funded by our institution, and as a result, the activities our fellows participate in are totally driven by the educational value. We're able to tailor the experience to the interests of the fellow. If someone wants to spend more time at Children's, they could do that. If they want to spend more time with the surgeons, they can do that. If they want to spend more time on a scholarly project, we can work around that. We have a core curriculum that provides excellent training in obesity medicine, but we have flexibility, and some of that comes from the way we're funded. A second differentiating feature is where we live administratively. Some programs are housed within surgery. We're not. We're a freestanding program. We have a great relationship with the surgeons. but surgery doesn't drive our program. This again allows us flexibility in the curriculum so that your educational experience really meets your needs. Well, you're going to have a lot of great choices. When our program started, there was only 11 Obesity Medicine Fellowships. Now there's 32. So there's a lot of great programs out there. But in my biased opinion, I think this is a great place for you to do obesity medicine training. Good luck as you think about this next important step in your professional development. I think you've picked an exciting field at an exciting time. I'm here to answer any questions that you might have.